So many people have questions regarding what is the virus, how does it affect us, what can we do about it? I mentioned once before that I was visiting Smithsonian Institute one day to see an exhibit about my teacher and his herbal medicine. And when I stepped out of the building, a guy approached me and told me that he was a patient of my teacher and he had been HIV positive. And then after the herbal treatment, he became HIV free. When I heard that story, I was shocked because, hey, I'm in Washington, D.C. I don't expect to meet somebody that knows, that I'm from Hawaii and who my teacher is. And then the second thing is, I probably made the medicine for that guy because that was my job back in those days. This virus that we're looking at, coronavirus, is very interesting because it does not have to go into the nucleus to translate into protein. It can replicate in the cytoplasm. That's incredible. When you spoke to me last, you mentioned something about a question about how does this affect children? And the answer is that we have, whether with children or adults, we have cellular membrane receptors that can bind to the proteins of the virus. As you know, COVID-19 is a disease of a spike protein virus, a coronavirus. Well, that corona, those spikes attach to specific receptors on the cell. When we look at this pattern, we say, okay, we can look for receptor sites in the body, and we can expect that the infection may or will continue there. And then we find strange things happening where the infections are occurring in other places that we didn't expect. How does that happen? Well, it happens because inflammation or chronic inflammation by itself can damage the membranes and allow for entry of the coronavirus proteins. That's really what's happening. So whether we say it can only affect older people or younger people or whatever, we just have to look at what are the targets of the virus, where does it attach in the body, and what can we do to block that process. We can start by blocking the attachment of the virus to the membranes of the cell and the receptors. And plants are notorious for that. There's a couple of things that we can look at to simplify this equation. One is, how does the virus replicate? And the other one is, how does that virus produce, end up amplifying the cytokines so that we have a amplification effect or cytokine storm? Once the RNA goes into the nucleus, it stimulates or activates between 150 to 200 genes. These genes are going to synthesize cytokines or pro-inflammatory signaling molecules that will activate or amplify or hyperinflame the immune system. So when we look at any kind of infection like this, we need to incorporate an understanding of the effect of inflammation, chronic inflammation, or in the case of COVID, hyperinflammation. If we can block hyperinflammation, we can stop a lot of the signs and symptoms that occur during the infection. So if we're trying to stop hyperinflammation or the production of cytokines, yes, definitely there's ample science to show that plants can do that. Historically, we use trial and error and intuition. Intuition is very important. I'm going to show you something right here. Can you see that yet? This is a device that we started to use in order to treat cancer patients a while ago. The solution I have in there is a tea from one of the plants that we use. We are currently conducting extensive research on this plant, and we discovered that it can do a lot of great things. Um, Historically, people said that they would look at the plant and they would communicate to the plant. The plant would say something like, use me. And we would say, we're not sure how to use you, but we will begin the process. And then as it unfolds and we're processing the medicine, a patient shows up and says, I have this problem. The medical world has no solution. Can you help me? And we will think about it and maybe pray about it or meditate about it. And then we will say, let's try this. And then this trial and error process can reveal whether we're successful or not, whether the herb is successful or not. In my case, I've been through this process. And then following that, I immediately start to research that plant when I've discovered how powerful it is. And the one that I just described to you or demonstrated to you, that's how I started with that plant. It spoke to me in my garden. I began to use it for patients. Doctors said they have nothing like that. But historically, trial and error, intuition. I started to define our ways of knowing, indigenous ways of knowing about 15 years ago. And, very similar to Chinese medicine and Western medicine. The first way of knowing is to na-na, or to look and to observe. I'll skip the Hawaiian words for you guys, but the second one is to listen. And the third one is to ask questions, get some history, get some feedback. And another one is to use your sense of touch. We even have using the sense of smell and intuition. And then, of course, we have trials. So that describes all of our indigenous ways of knowing that we practice in order to uncover solutions for healthcare problems. This is going to be part of the new tradition, this ways of knowing that I just described to you. A friend of mine calls me up. He says, oh, my daughter is constipated. She's very small toddler, and she hasn't gone to the bathroom in days and days. Is there anything you can do? So I said, come and meet me in the garden. I met him in the garden, and I took her hand, and I walked with her through the garden, and we were speaking. She reached up and grabbed the fruit from the tree and began eating it. The father came over there and told me, stop her, she's eating that fruit. I said, let her eat the fruit. Anyway, after that, they went home. I called him back. I said, how's it going? He says, perfect. She went to the bathroom. Okay, in this case, the infant, the toddler, who couldn't even speak, selected the appropriate solution for her problem. That's just one story. There's so many. About 12 or so years ago, I was confronted with the issue of working with academia and dealing with the concept of complementary and alternative medicine. Personally, I find that confusing and misleading. So I suggested that we use a new term, integrative medicine. Over time, medical schools across the country, the United States, began to change the name of their department from complementary and alternative medicine to integrative medicine and healthcare. Okay, this is a pretty good, sign of evolution. We need to recognize that our world of using pharmaceuticals is not the whole world. Most of the world does not use pharmaceuticals. They use plants. I work with the local medical system. That we have many patients that we work with. Many of them are not inclined to use any plant-based medicines. So we're not going to go against their belief system. We're going to work within our own belief system and people who share that belief system. And if we're going to treat a patient with a specific complaint, sometimes they don't know what the problem is. So we need to investigate. We need to do an assessment. And then we need to discover what kind of herbal treatment is appropriate for them, or a combination of herbal treatment and what we call ho'oponopono, which is another system of healing. It helps to heal relationships. and also manual medicine. We have Lomi Lomi. We combine all of those things to do Hawaiian healing medicine. So they help to address psychosocial issues that the patient or the patient's family may have.